Welcome to Your Body at Its Best with your host, Craig Jenkins. Brought to you by Performance Medicine.
Welcome back into CW20 here on this Wednesday morning. Dr. Tom Rogers back again for great medical tips, great medical advice from Performance Medicine. Check him out online too, folks, performancemedicine.net. Tons of great information, and you can kind of get a preview of the practice there. Dr. Rogers, the Affordable Care Act is in complete shambles right now. New president, new administration, especially in Tennessee, it's in shambles. What kind of changes do you expect to see down the road?
Well, you know, over the past 30 years that I've been practicing, medicine has changed so much. We don't practice anything like we did 30 years ago, at least if you keep up with things. But, you know, there is a major healthcare crisis going on, and the problem is really transparency with healthcare cost and what you really need, what you can afford, types of insurances to get, are you covered, everybody's deductibles going high. So that's why I decided to change my practice 10 years ago to a cash model. So several things have happened. Number one, I became a much better doctor. Number two, it became much more affordable for my patients. Number three, I got to spend more time with my patients. I have no incentive to run an unnecessary test. I think that's the way things are headed. It's almost ridiculous how much that they charge you to be seen in an emergency room or a hospital, or costs are out of control. So really, people need to almost be their own doctor, to take control of their own health, and that's why I do this.
What were the original intentions of insurance in the beginning?
Well, in the beginning, insurance was meant to cover disaster. That's what insurance is. Then it became something that everybody had by their employer, and they expected it to cover every cold or wart they had. So the cost just spiraled out of control, and that's where we are now.
So Performance Medicine in your practice, you do it completely differently. However, it's far more affordable for me, the patient, and that's great news.
I'm sure it is, but the bottom line and why I do this is really to help people understand how they can keep healthy. It's not really for the money. It's really, you know, at my age, I've made enough money through my life. I just really want to carry a message to improve people's health.
Finally, a doctor, folks, you can talk to. It's Dr. Tom Rogers. He's at Performance Medicine. Check him out on the web at performancemedicine.net. Back with more next week.